According to the Movember Foundation, men die an average 6 years younger than women, and for reasons they are largely preventable. So joining us this morning is Dr. Charles Osterberg. He is the Chief of Urology over the Dell Seton Medical Center. And thank you for joining us, Dr. Osterberg. It's good to see you again.
Good to see you.
You know, for Movember, we're here to talk about men's issue. And why is it that many men don't like going to the doctor's office?
Well, you know, I think it has something to do with the fact that they may feel vulnerable when they go to the doctor's office. You know, men oftentimes feel that their masculinity may be compromised by voicing some concerns about some of their health problems, and they often may keep that health issue to themselves and no longer seek care as a result.
And so as a female, as a married woman, how can we help the men in our lives change that?
Well, I think it starts with having a good support system. So having a spouse or a daughter or a son encourage their father figure or their boyfriend, their husband, etc., to seek out care. Only when we have a good support system do we encourage men to go ahead and seek out care and undergo routine screenings.
And you know, as a urologist, you see prostate cancer. Let's talk about that. Talk about the risk of that and why is it so important to seek out help for that?
Sure. So prostate cancer is the second most common cancer in men aside from skin conditions. So roughly 160,000 men are diagnosed with prostate cancer every year, which puts us at about roughly 1 in 9 men being diagnosed with prostate cancer every year. So it is extremely common. The good news is prostate cancer is extremely slow growing. So if caught early, prostate cancer is very treatable, and in order to diagnose prostate cancer and effectively treat it, we have to undergo screening, and that's part of what Movember is all about. Encouraging men to speak out about men's health, create awareness, and it's not just prostate cancer, it's all men's health.
Absolutely. So get them in the doctor, but while we're at home, what can we look out for?
Sure. Well, I mean, any symptoms out of the ordinary, but in addition to that, it's kind of routine maintenance. Mm-hmm. So going to the dentist, getting your eye exams, going for blood pressure checks, getting your cholesterol checked, your sugars, and the list goes on, and we have very clear guidelines of when men should get screened for certain conditions. We know that men are more likely to die from prostate cancer, as well as colon cancer, lung cancer, have a higher suicide risk compared to women. So these are all conditions that are preventable if we potentially change our paradigm thinking about what it means to be a man and encourage awareness.
No, absolutely. We said at the top of the interview, men are more likely to die, what is it, 6 years younger?
6 years younger, yeah.
Yeah, we get them to the doctor, get them talking about it, telling them it's okay. We'll even go with you to the doctor, yeah. Right? I mean, it's absolutely okay. So
sure.
If we can just go back to the at home, unusual signs. What do you mean unusual signs, Dr. Osterberg?
Well, I mean, it boils down to, you know, anything out of the ordinary. So for example, if you're experiencing some chest pain, that may be potentially a sign of having some atherosclerosis of the heart. Trouble breathing may be a sign of something lurking beneath the lungs. Indigestion or GI upset may be something in regards to ulcer disease of the stomach. And the list goes on, but being in close attention to some of these symptoms can help prevent potentially devastating complications down the road.
Yeah, the bottom line is talk about it, go see a doctor. It's okay.
It's okay. It's going to be okay.
That's right. Dr. Osterberg, good to see you again, and we appreciate you joining us this morning. And
thank you.
Of course, if you want to learn more about Movember and men's health, just visit the links mentioned section on our website at KVUE.com.